Get an opportunity to give some opening remarks, but we really hope to get into a dialogue. And then if we have time, we're going to get a quick look around so that he can have some appreciation for what a little hospital in the middle of Iowa does to try to meet the needs. So please help me welcome Senator John McCain.
Thank you very much, Tom. Thank you very much. If it's agreeable to you, I'd just like to remind you of the enormity of the challenge that we face in healthcare in America. And then talk to you about some of the proposal that I'm going to be outlining in more detail tomorrow. And then I'd like to respond to any questions or comments or insults that you might have. May I just mention, I don't know why I happened to think of it, but on several occasions, my x-rays have appeared in orthopedic journals because I had broken bones when I was shot down and captured, and they healed by themselves. So it's kind of an oddity. And I'll be glad to show anybody my x-rays if they'd be glad to. So they're not that exciting, but, you know, doctors are kind of dull anyways, you know. So anyway, I think you know that, there goes the doctor. Well, you know the difference between a lawyer and a catfish? One is a scum-sucking bottom dweller, and the other is a fish. So that takes care of the lawyer. Anyway, my friends, look, let's face it. In the year 2000, when I was in the last presidential campaign, healthcare was a concern. Healthcare today is the #1 domestic issue facing America, and you know it, and you know it as well as I do. And you grapple with the problems of cost, availability, affordability, insurance, and all of those different aspects of a very complex issue on a daily basis. So I don't pretend to come to you knowing more than you do. In fact, I'm here to learn as much as I am to talk. But I just want to remind you of the gravity of this situation nationwide. If we don't act by 2015, the healthcare system will implode in a perfect storm. We currently spend $2.2 trillion, 16 cents of every dollar we spend, on health care. By 2015, just 7 years from now, our expenditures will nearly double to $4 trillion, and conditions will come together to destroy our system of care. That's the kind of crisis that we're looking at. Medicare will be broke by 2019, be flat broke by the year 2019, and currently, as you know, we're spending more on Medicare than we are collecting in payroll taxes. We're cashing in the few IOUs left. In the meantime, more and more of our retirees' Social Security checks will also go to pay Medicare. The annual cost of living adjustment increases in the checks will never keep up with the increases in the cost of health care. If you got double-digit inflation associated with health care, or close to it, if you saw the front page of USA Today a couple of days ago, it said inflation in Medicare has jumped up to about 10%. And you only get a cost of living adjustment, which is about 2.5%, you can do the math as to what happens to retirees' Social Security and their ability to live a life of retirement that with dignity and with the kind of comfort that they have earned. So I just want to point out to you that Social Security is on the same trajectory. By 2017, more money will be going out of Social Security than is coming in. And Medicaid will cost states more than any other responsibility, even more than education. So our companies will be unable to compete around the world. As you may know, we just had a debate the other night in Dearborn, Michigan. I don't know if you heard me mention the fact that one of the reasons why the automobile industry in Michigan is in such difficulty in competing with foreign manufacturers, including foreign manufacturers that are locating manufacturing plants in Georgia and Mississippi and Alabama, is because before they turn a wrench in Detroit, there's a $1,700 health care cost to pay for their legacy health care costs because of health care that they promised retirees as well as employees. And in Toyota, it's $200. So you got a $1,500 differential to start with. And that's why, obviously, we need to fix this system and fix it soon. So, I want to fight to save the future of Social Security and Medicare, and I want to solve the problem. Now, what are some of my thoughts and ideas? We got to bring costs under control. It's the best health care in the world. You get the best medical care here than any place in Europe or in this planet. But I also would point out to you that the Japanese and the Europeans pay half as much as we do in health care costs, and they live longer. We ought to think about that. We ought to think about it and think about it seriously. I think that we've got to focus on paying for quality outcomes that will bring costs under control by eliminating low-value approaches. I think that American families should be able to be in charge of their health care dollars through health savings accounts and tax credits. One of my proposals will be that every low-income family in America have a $2,500 tax credit per person and $5,000 tax credit, health care tax credit per family. We need to force the system to compete. I saw the headline of the Des Moines Register this morning about the scandal concerning the pharmaceutical companies. I don't know what there is to it, but it seems to me, from the little I understand about it and talked to a couple of people, it's got to do with transparency. It's got to do with transparency. Every American should know the cost of a pharmaceutical before that it comes out of their hard-earned tax dollars to pay for it. So we need to reform the payment systems, in my view, from paying for fragments of care. I think we should pay providers an annual fee for care that meets quality standards when treating patients with chronic disease or multiple chronic diseases rather than a per service basis. I know that is a controversial proposal. I think obviously we need to require total transparency, which we are finding out apparently in the state of Iowa that's not the case today. Not just about pharmaceuticals, but in every other aspect of health care in America. I think Medicare should not pay for preventable medical errors or mismanagement. Medicare should move to a single payment for all the care of the most complex types of cases. I think we should permit providers to practice nationwide. I see no reason why, if there's a better health insurance plan available in Arizona, that you ought to be able to take advantage of it rather than be confined to the state of Iowa. I think that supporting innovative delivery systems such as clinics and retail outlets and other ways that provide greater market flexibility in permitting appropriate roles for nurses, practitioners, nurses, doctors, and other medical personnel. Foster the development of routes for safe, cheaper, generic versions of drugs and biological pharmaceuticals. Develop safety protocols that permit reimportation from Canada if necessary to keep competition vigorous. Pass tort reform. I don't think there's a doctor that you know that wouldn't, in all honesty, tell you that doctor sometimes feels forced to practice defensive medicine for fear of being in court. We need to reform that, my friends, not only because of the increased cost, but many of you know there's a lot of discomfort involved in it as well. So we need to do that, and we need to maintain market competition through vigorous enforcement of federal protections against collusion, unfair business actions, and deceptive practices. I think that families should have insurance available through any willing sponsor. Any group or organization that wants to provide health insurance policies, they should be able to do that. One of the key problems we know in America today, in this information technology revolution we're going through, is the movement from job to job. Right now, one of every American's greatest fear that's working is that they move from one job to another and they lose their health insurance policy because they lose the employer contribution to it, as you know. I believe that we've got to provide them with a minimum health insurance policy which will provide them with the safety and security of health insurance as they move from one job to another. We need to obviously reform the tax code to eliminate the bias toward employer-sponsored health insurance. You know, Ronald Reagan once said, nobody ever washed a rental car. Now, if it's your $2,500 you're getting in a tax credit, I think you're going to be a lot more careful about where you spend it and what kind of policy you acquire than if it's